Did you know that the jawbone plays a crucial role in shaping the lower half of your face? It also helps with speech and chewing. So what happens when the jawbone starts to shrink? Keep watching to learn about the causes, symptoms, and treatment options for jawbone loss. Causes of jawbone loss. The primary cause of jawbone loss is tooth loss. You see, the roots of your teeth send signals to your brain telling it that this area is important and needs lots of calcium, blood supply, and other resources. As a result, your jawbone grows and stays strong. But when teeth are missing, whether because they were removed or fell out, this vital communication stops. The jawbone then begins to deteriorate. Another common cause is gum disease. When the gum tissue around your teeth is infected and inflamed for a long time, it can affect the structures holding your teeth in place. This can lead to the gradual erosion of both the gums and the jawbone. In advanced cases, this bacterial infection can cause tooth loss and make the jawbone thinner. Trauma is another cause of bone loss. For example, if a tooth is knocked out or broken, it can cause bone loss. The same is true for a fractured jaw. Sometimes it can take years for bone loss to begin after the initial injury. Other causes include infections, genetic defects, smoking, and some medications like bisphosphonates. Certain general medical conditions can also play a role. These include osteoporosis, osteonecrosis, thyroid disorders, radiation therapy, and Paget's disease of bone. Symptoms of jawbone loss. The symptoms and signs of jawbone loss depend on the cause and can vary. Some common ones are loose teeth, changes in bite or chewing, wrinkles forming around the mouth, and changes in facial appearance. Additionally, pain when chewing, eating, or talking can occur due to constant jawbone contraction. In rare cases, bone loss can result from jawbone cell death osteonecrosis. This can cause symptoms like unexplained loose teeth and intense pain in the mouth. Other signs include non-healing wounds in the mouth, pus discharge, and exposure of the jawbone inside the mouth. Treatment of jawbone loss. If you're experiencing jaw pain, it's important to visit your dentist. They will evaluate your condition, diagnose the underlying cause, and recommend the best treatment. They may also refer you to a specialist called an oral surgeon. The first step in treating jawbone loss is to give the jaw adequate rest. This means avoiding hard or overly soft foods and speaking gently. Other treatments depend on the underlying cause. For example, if the jawbone is affected by gum disease, your dentist will likely perform a deep cleaning called scaling and root planing to remove bacteria and plaque from the teeth and below the gum line. In many cases, the most common and effective treatment for jawbone loss is jawbone grafting. This procedure involves replacing the deteriorated bone tissue with a material that the body can absorb and gradually replace with healthy, natural bone tissue. Bone grafts can help regenerate and rebuild bone. However, the success of this treatment depends on various factors such as the grafting technique used and the condition of the jaw and surrounding tissues. In some cases, your dentist may prescribe a medication called teriparatide. This synthetic version of a natural hormone has shown promise in stimulating bone growth in certain studies. However, the use of this medication is uncommon and depends on the dentist's judgment and the specific circumstances of the case. Prevention of jawbone loss. While it's impossible to prevent all causes of jawbone loss, you can take steps to reduce your risk. One of the most important things you can do is to avoid smoking and all forms of tobacco use. Tobacco smoke reduces blood flow to the gums, making it harder for them to stay healthy. And unhealthy gums can lead to tooth loss and jawbone deterioration. Maintaining a balanced diet rich in calcium, phosphorus, and other essential vitamins and minerals is also important. These nutrients are crucial for strong bones and overall oral health. Don't forget to take care of your teeth. If you have any, as tooth loss can trigger jawbone loss, it's important to visit your dentist regularly for checkups and professional cleanings. If you do lose a tooth, consider getting a bridge or a dental implant to preserve the structure of your jawbone. If you notice any signs or symptoms of jawbone loss, don't hesitate to seek help from your dentist. Early intervention can make a big difference in preventing further complications. Remember, your oral health is essential to your overall well-being. So take care of your teeth and visit your dentist for regular checkups.